HY review, gram-negative bacteria, 40 questions on the bugs the NBME loves, Neisseria, the respiratory rods, the gut, enterobacteria ACA, Pseudomonas, the curved rods, and the zoonosis. Read the vignette, spot the clue, name the bug or its mechanism, and move. 40 questions, 60 minutes. Clock starts now. What is this adrenal complication called? A 19-year-old college student in a crowded dormitory develops sudden high fever, headache, and a rapidly spreading petechial rash that turns to purpura. Blood pressure collapses and labs show disseminated intravascular coagulation. Blood cultures grow gram-negative diplococci, and imaging shows bilateral adrenal hemorrhage. Read the command, name the adrenal syndrome. Meningococcemia with bilateral adrenal hemorrhage is Waterhouse, Frederickson. Waterhouse. Frederickson syndrome is acute adrenal failure from bilateral adrenal hemorrhage during fulminant Neisseria meningitis sepsis. The endotoxin-driven DIC and shock destroy the adrenal glands, causing a sudden loss of cortisol and cardiovascular collapse. The correct answer is D. Sheehan syndrome is postpartum pituitary infarction, not adrenal hemorrhage during sepsis choice, wrong. Chronic primary adrenal insufficiency, Addison disease, develops S. lolli from autoimmune destruction, not the acute hemorrhagic collapse seen here, choice B, wrong. This is Waterhouse, Frederickson syndrome. Which immune defect best explains the recurrent Neisseria infections? A 17-year-old has had 3 separate episodes of Neisseria, meningitis bloodstream infection. A full immune workup is normal, except that the CH50 assay is markedly low. Read the command, the defect behind recurrent Neisseria. Low CH50 means terminal complement, MAC deficiency. Recurrent Neisseria infections point to a terminal complement, C5-C9 deficiency, which cannot assemble the hemiprane attack complex MAC. Neisseria are thin-walled and are killed mainly by MAC-mediated lysis, so without it the body cannot clear them. A low CH50 confirms a defect in the complement cascade. The correct answer is B. Selective IgA deficiency causes recurrent sinopulmonary and GI infections plus anaphylaxis to blood products, not specifically recurrent. Neisseria choice A, wrong. Chronic granulomatous disease predisposes to catalase. Positive organisms like S. aureus, not the failure of Neisseria lysis choice D, wrong. This is a terminal complement deficiency. Which organism is most likely? A sexually active 24-year-old woman has several days of migratory joint pain, then a swollen, hot knee. She also has scattered pustular skin lesions and pain along the tendon sheaths of the wrist. Gram stain of joint fluid shows gram-negative diplococci, and there is no vaccine to prevent this organism. Read the command. Identify the organism. Migratory arthritis, pustules, and tenosynovitis is disseminated gonococcus. Neisseria, gone. Neisseria gonorrhoeae causes disseminated gonococcal infection. The triad of migratory arthritis, tenosynovitis, and pustular skin lesions in a young sexually active adult. It has no vaccine because it constantly varies its pilus antigens, and unlike meningococcus, it has no polysaccharide capsule and does not ferment maltose. The correct answer is A. Neisseria meningitis is also a gram-negative diplococcus, but it ferments maltose, has a capsule and a vaccine, and causes meningitis or meningococcemia rather than this arthritis dermatitis syndrome. Choice B, wrong. Staphylococcus aureus causes a monoarticular septic arthritis, but appears as gram-positive COCCI in clusters, not diplococci. Choice C, wrong. This is Neisseria. What is the most likely cause? A newborn develops a profuse, thick, purulent conjunctivitis on day 3 of life. The mother received no prenatal care. Gram stain of the discharge shows gram-negative diplococci. Read the command. Cause of day 3, purulent neonatal conjunctivitis with diplococci, gonococcal ophthalmia, gonococcal ophthalmia. Neonatal appears yearly at 2 to 5 days of life as a profuse purulent conjunctivitis that can rapidly threaten the cornea. It is acquired passing through an infected birth canal, which is why erythromycin eye ointment is given to every newborn as prophylaxis. The correct answer is E. Chlamydia trachomatis conjunctivitis appears later at 5 to 14 days, is more watery to mucopurulent, and shows no organisms on gram stain. Choice or wrong. Chemical irritation from silver nitrate appears within the first day and is mild and self-limited. Choice C. Wrong. Early purulent conjunctivitis with diplococci is gonococcal. Which organism is most likely? An unvaccinated 4-year-old has rapid onset high fever, drooling, a muffled hot potato, voice, and sits leaning forward in the tripod position. A lateral neck film shows a swollen, thumb-shaped epiglottis. Read the command. The organism causing epiglottitis. Thumbprint sign plus an unvaccinated child is he. Acute epiglottis in an unvaccinated child is classically Haemophilus influenzae type B. The swollen epiglottis gives the thumbprint sign on a lateral neck film, and the child drools, leans forward in the tripod position, and has a muffled voice. It is an airway emergency. Do not examine the throat blindly. The correct answer is C. Parainfluenza virus causes CROEP with a barking cough and a subglottic steeple sign, not the thumbprint epiglottis of epiglottitis. Choice or wrong. Corynebacterium diphtheriae produces a gray pharyngeal PSEU dome membrane, not the cherry red swollen epiglottis seen here. Choice E. Wrong. This is Haemophilus influenzae type B. Which 2 growth factors does this organism require? A microbiology lab grows Haemophilus influenzae. It grows well on chocolate agar, and on a sheep blood plate it forms tiny colonies only right next to a streak of Staphylococcus aureus, satellite phenomenon. Read the command. The growth factors for H. influenzae. It needs factor V, NAD, and factor X, hematin. Haemophilus influenzae requires 2 accessory factors to grow, factor V, NAD, and factor X, hematin. Chocolate agar, gently heated blood releases both. On a plain blood plate, it grows only next to S. aureus, which lyses red cells and supplies factor V, the classic satellite phenomenon. The correct answer is A. Cysteine and iron are the requirements of Legionella on charcoal yeast extract agar, not of Haemophilus. Choice B. Wrong. Charcoal, yeast extract, and cysteine again describe the Legionella medium, not the factor V and X pair. Choice C. Wrong. H. Influenza needs factors V and X. What is the mechanism of this toxin? A 6-month-old who is behind on vaccines has 2 weeks of severe coughing fits that end in a whooping inspiration and post-tussive vomiting. The white count shows a marked lymphocytosis. The responsible toxin ADP ribosylates a regulatory G protein. Read the command. The mechanism of pertussis toxin. It disables G, so count rises. Bordetella pertussis causes whooping cough, and its pertussis toxin AP ribosylates the inhibitory G protein G, switching it off. With the off signal disabled, adenylate cyclase runs unchecked and camp rises. This drives the marked L1 lymphocytosis and blunts phagocyte function. The correct answer is D. Blocking acetylcholine release is the mechanism of botulinum toxin unrelated to the cough of pertussis. Choice A. Wrong. ADP ribosylation of elongation factor 2 is how diphtheria and Pseudomonas exotoxin, a halt protein synthesis, not how pertussis raises camp. Choice B. Wrong. Pertussis toxin disables G to raise camp. Which organism is most likely? A 60-year-old smoker develops high fever, cough, confusion, and watery diarrhea. Labs show hyponatremia and mildly elevated liver enzymes. He recently stayed at a hotel with an air conditioning cooling tower and no organisms are seen on a routine sputum gram stain. Read the command. Identify the organism. Pneumonia with hyponatremia, diarrhea, and a water source is Legionella. Legionella pneumophila causes a severe atypical pneumonia with high fever, confusion, watery diarrhea, and a characteristic hyponatremia. It spreads from water sources, air conditioning, cooling towers, and hot tubs, but not person to person. It stains poorly on a routine gram stain because it is a faint intracellular gram negative rod. The correct answer is B. Streptococcus pneumoniae causes a typical lobar pneumonia with rusty sputum and clear gram-positive diplococci. Not this hyponatremic, diarrheal, poorly staining picture choice are wrong. Mycoplasma causes a walking pneumonia in young adults with a milder course and no hyponatremia or cooling. Choice C wrong. This is Legionella pneumophila. Which laboratory approach best identifies this organism? The team strongly suspects Legionella pneumonia and wants to confirm it quickly. Read the command how to identify Legionella. Charcoal yeast extract with cysteine and iron plus the urine antigen. Legionella is grown on buffered charcoal. Yeast extract agar, which supplies the cysteine and iron it needs. In practice, the fastest test is the Legionella urine antigen, which detects serogroup 1. In tissue, it is seen with a silver stain. The correct answer is E. McConkey agar source the L-acetose fermenting Enterobacteria acacia, and Legionella does not grow on it. Choice A wrong. There. Martin VCN agar is the selective medium for Neisseria, not Legionella. Choice B wrong. Legionella needs charcoal yeast extract with cysteine and iron. Which organism does this vaccine target? Before a certain conjugate vaccine became routine, one encapsulated organism was the leading cause of childhood bacterial meningitis and epiglottitis. Its type B capsule is made of polyribosylribitol phosphate (B-PAR-P). Read the command. The organism the conjugate vaccine targets. The type B PRP capsule is H. Influenzae type B. Haemophilus influenzae type B was historically the top cause of childhood bacterial meningitis and epiglottitis. Its virulence comes from the polyribosylribitol phosphate PRP type B capsule. The HIP conjugated vaccine links PRP to a protein so infants mount a strong response and invasive disease has plummeted. The correct answer is C. Neisseria meningitidis has its own separate vaccine and causes meningitis mainly in adolescents, not the PRP capsule organism described. Choice A wrong. Streptococcus pneumoniae is a gram-positive diplococcus with its own conjugate vaccine, not the type B PRP capsule here. Choice B wrong. This is Haemophilus influenzae type B. Which organism is most likely? A 26-year-old woman has dysuria and urinary frequency. Urine culture grows a gram-negative rod that ferments lactose, forming pink colonies on McConkey agar, and it attaches with P. fimbriae. Read the command, identify the organism. The E1 UTI cause, a lactose-fermenting gram-negative rod, is E. coli. Escherichia coli is the most common cause of urinary tract infection. It is a gram-negative rod that ferments lactose, forming pink K colonies on McConkey agar, and it grips the urinary tract using P. fimbriae EPF. It is also a leading cause of gram-negative sepsis and neonatal meningitis. The correct answer is B. Staphylococcus saprophyticus is the second most common UTI cause in young women, but it is a gram-positive coccus, not a lactose-fermenting rod. Choice a wrong. Proteus also causes UTI, but it does not ferment lactose and produces urease with alkaline, foul-smelling urine. Choice C wrong. This is Escherichia coli. Which organism is most likely? A 6-year-old develops bloody diarrhea and cramps a few days after eating an undercooked hamburger. A week later, she has pallor, low platelets, and rising creatinine. The organism does not ferment sorbitol and makes a Shiga-like toxin. Read the command. The organism causing bloody diarrhea and HUS after a burger. EHEC 0157 H7. Enter. Enterhemorrhagic E. coli 157 comes from undercooked beef and causes bloody diarrhea that can progress to hemolytic uremic syndrome, hemolytic anemia, thrombocytopenia, and acute kidney injury. It makes a Shiga-like toxin and, unlike most E. coli, does not ferment sorbitol. Do not give antibiotics which raise the risk of HUTL. Do not give antibiotics which raise the risk of Hughes cystogenic syndrome. The correct answer is D. Shigella also makes Shiga toxin and can cause HUS, but it spreads person to person with a tiny inoculum rather than from undercooked beef. Choice A wrong. Enterotoxigenic E. coli causes watery traveler's diarrhea with no blood and no HUS. Choice E wrong. This is EHEC 057 H7. Which organism is most likely? A traveler returning from Mexico has several days of profuse watery diarrhea with cramps but no blood and no fever. The organism makes a heat labile toxin that raises CAMP and a heat stable toxin that raises CGMP. Read the command. Identify the organism. Watery traveler's diarrhea with heat labile and heat stable toxins is ETEC. Enterotoxigenic E. coli ETEC is the top cause of traveler's diarrhea, profuse watery diarrhea with no blood and no tissue invasion. It makes two toxins, a heat labile toxin that raises CAMP like cholera and a heat T stable toxin that raises CGMP, both driving fluid loss into the gut. The correct answer is A. Vibrio cholerae also raises CAMP, but it produces massive rice water stools linked to contaminated water, not this milder traveler's illness with both LT and ST toxins. Choice B wrong. Giardia causes a fatty, foul, prolonged diarrhea after camping or freshwater exposure, not an acute secretory toxin picture. Choice C wrong. This is ETEC. Which organism is most likely? A 5-day-old born after prolonged rupture of membranes develops fever, lethargy, and poor feeding. CSF grows a gram-negative rod that ferments lactose, and the strain carries a K1 capsule. Read the command. Identify the organism. A lactose fermenting gram-negative rod with a K1 capsule is E. coli. Esch. Escherichia coli is a leading cause of neonatal meningitis, alongside group B strep and Neisseria. Its key virulence factor here is the K1 capsule, which resists complement and phagocytosis and lets the organism invade the meninges. It is a gram-negative rod that ferments lactose. The correct answer is E. Group B streptococcus is the top neonatal meningitis cause, but it is a gram-positive coccus in chains, not a gram-negative rod. Choice A wrong. Listeria also causes neonatal meningitis, but is a gram-positive ROD with tumbling motility and no K1 capsule. Choice B wrong. This is Escherichia coli. Which organism is most likely? A 58-year-old man with alcoholism and diabetes develops fever and a cough productive of thick, blood-tinged currant jelly, sputum. Chest X-ray shows a right upper lobe consolidation with a cavity. Sputum grows a heavily encapsulated lactose-fermenting gram-negative rod. Read the command. Identify the organism. Currant. Jelly sputum in an alcoholic with a thick capsule is Klebsiella. K-A-E Bebsiella. Malmonia. Causes an aspiration pneumonia in alcoholics and diabetics with thick, blood-tinged currant jelly sputum and a tendency to cavitate. It is a lactose-fermenting gram-negative rod with a large, mucoid capsule. Remember the 4 A's: aspiration, abscess, alcoholics, diabetics. The correct answer is C. Streptococcus pneumoniae gives rusty sputum and rarely cavitates, and it is a gram-positive diplococcus, not an encapsulated gram. Negative rod. Choice A wrong. Mycobacterium tuberculosis also cavitates in the upper lobe, but it is an acid-fast organism with a slow chronic course, not this acute current jelly picture. Choice E wrong. This is Klebsiella pneumoniae. Which organism is most likely? A 25-year-old returns from India with a week of rising stepwise fever, abdominal pain, and constipation followed by pea soup diarrhea. Exam shows hepatosplenomegaly, relative bradycardia, and faint rose-colored spots on the trunk. The organism can persist in the gallbladder as a chronic carrier state. Read the command. Identify the organism. Stepwise fever, rose spots, and a gallbladder carrier state is Salmonella typhi. Salmonella. Type I causes type I-wide enteric fever, a stepwise rising fever, rose spots on the trunk, hepatosplenomegaly, and relative bradycardia, often in a traveler. It survives inside macrophages and can lodge in the gallbladder, creating a chronic carrier state, typhoid Mary. Humans are the only reservoir. The correct answer is D. Shigella causes an acute bloody dysentery with a low inoculum, not the systemic stepwise fever, and rose spots of typhoid. Choice are wrong. Brucella causes unulent fever from unpasteurized dairy but lacks rose spots and the gallbladder carrier state. Choice B wrong. This is Salmonella typhi. Which organism is the classic cause in this patient? A 9-year-old with sickle cell disease develops fever and bone pain, and imaging confirms osteomyelitis. Blood cultures grow a motile, non-lactose fermenting gram, negative rod that produces H2S. Read the command. The classic osteomyelitis organism in sickle cell, Salmonella. In sickle cell disease, Salmonella is the classic cause of osteomyelitis. Gut microinfarcts and functional asplenia make these patients uniquely prone to Salmonella seeding bone. Non-typhoidal Salmonella is a motile, non-lactose fermenting gram-negative rod that makes H2S, often acquired from poultry, eggs, or reptiles. The correct answer is A. Staphylococcus aureus is the most common cause of osteomyelitis in the gene neural population, but in a sickle cell patient, the tested answer is Salmonella. Choice B wrong. Pseudomonas causes osteomyelitis after a puncture wound through a shoe or in IV drug users, not the sickle cell association. Choice C wrong. In sickle cell, think Salmonella. Which feature best distinguishes this organism from Salmonella? A 3-year-old in a daycare outbreak has fever and scant bloody mucoid stools. Only a very small number of organisms is needed to cause disease, and the bug produces Shiga toxin. The lab must separate it from Salmonella. Read the command. The feature separating Shigella from Salmonella. Shigella is non-motile and spreads cell to cell. Shigella is non-motile, no H antigen, and invades the colon, spreading directly cell to cell using actin. Exactly how it differs from the motile, flagellated Salmonella. It needs only a tiny inoculum, does not make H2S, and produces Shiga toxin, giving bloody mucoid dysentery. Salmonella, by contrast, is motile in H2S. The correct answer is B. Being motile with flagella describes Salmonella, not Shigella, which is non-motile. Choice A wrong. Producing abundant H2S is again a Salmonella trait. Shigella is H2S negative. Choice C wrong. Shigella is the non-motile cell-to-cell invader. Which statement about antibiotics is correct? 2 children have bacterial gastroenteritis, one grows non-typhoidal Salmonella, and the other grows Shigella. A resident asks how antibiotics should be used. Read the command. The correct antibiotic statement. Antibiotics can prolong the Salmonella carrier state. For non-typhoidal Salmonella gastroenteritis, antibiotics can prolong the fecal carrier state and are usually withheld in healthy hosts because the illness is self-limited. Shigella, by contrast, is typically treated to shorten symptoms and cut its highly contagious spread. The two are managed differently. The correct answer is E. Saying antibiotics shorten the salmonella carrier state is the opposite of the truth. They can lengthen it. Choice A wrong. Antibiotics are not always required for non-typhoidal salmonella. Healthy patients are managed supportively, reserving drugs for the very young, old, or immunocompromised. Choice B wrong. Antibiotics can prolong the salmonella carrier state. Which organism is most likely? A 55-year-old woman has recurrent UTIs. Urinalysis shows alkaline urine, pH 8.5, and imaging reveals a large staghorn calculus. Culture grows a swarming, non-lactose fermenting gram-negative rod that is strongly urease positive and smells of ammonia. Read the command. Identify the organism. Urease, positive. Alkaline urine, staghorn stone, swarming motility is Proteus. Pothos, mirabilis, produces urease, which splits urea into ammonia and alkalinizes the urine. This precipitates stearabite AD magnesium, ammonium phosphate A staghorn stones. It shows swarming motility on agar, does not ferment lactose, and gives urine a fishy ammonia smell. Its antigens also cross-react in the Wall-Felix test. The correct answer is C. Escherichia coli is the most common UTI cause overall, but it ferments lactose and does not make the urease that alkalinizes urine and forms struvite stones. Choice A wrong. Staphylococcus saprophyticus can be urease positive, but is a gram-positive coccus without swarming motility and is not the classic staghorn stone organism. Choice D wrong. This is Proteus mirabilis. Which organism is most likely? A 7-year-old develops fever, right lower quadrant pain, and diarrhea after the family got a new puppy and ate some undercooked pork. At surgery, the appendix is normal, but the mesenteric lymph nodes and terminal ileum are inflamed. Read the command. Identify the organism. Pseudoappendicitis from mesenteric adenitis after puppy or pork exposure is Yersinia enterocolitica. Yersinia enterocolitica causes P. pseudoappendicitis, fever, and right lower quadrant pain from mesenteric adenitis and terminal ileitis that mimic appendicitis, but the appendix is normal. Classic exposures are puppies, contaminated pork chitterlings, or unpasteurized milk. It can grow at cold temperatures, cold enrichment. The correct answer is A. Campylobacter jejuni causes bloody diarrhea and can precede Guillain-Barré, but it is not the classic pseudoappendicitis with normal appendix picture tied to puppies and pork. Choice B wrong. True acute appendicitis would show an eye inflamed appendix at surgery, whereas here the appendix is normal and the nodes are inflamed. Choice C wrong. This is Yersinia enterocolitica. Which organism is most likely? An ICU patient with a urinary catheter and a ventilator develops a hospital-acquired infection. The gram-negative rod grows as colonies with a striking red pigment and is resistant to multiple antibiotics. Read the command. Identify the organism. A red pigmented multi-drug resistant nosocomial gram-negative rod is Serratia. Serratia marcescens is a nosocomial gram-negative rod that classically produces a red pigment prodigiosin. It causes catheter-associated UTIs, pneumonia, and bloodstream infections in hospitalized patients and is often multi-drug resistant. The correct answer is E. Pseudomonas aeruginosa is also a resistant nosocomial rod, but it makes a blue-green pigment pigocyanin, not red. Choice A wrong. Escherichia coli causes many hospital UTIs, but does not produce the striking red pigment described. Choice B wrong. This is Serratia marcescens. Which organism is most likely? A patient with severe burns develops a wound infection with blue-green pus that has a sweet, grape-like odor. The gram-negative rod is an obligate aerobe and is oxidase positive. The same organism is a top pathogen in cystic fibrosis. Read the command. Identify the organism. Blue-green pus, grape odor, burns, and CF oxidase positive is Pseudomonas. Pseudomonas aeruginosa is an aerobic oxidase T positive gram-negative rod that thrives in moist settings. It makes the blue-green pigment p-guanine and a sweet, grape-like odor. It is a top cause of burn wound infections and of chronic lung infection and CY stick fibrosis, plus hospital pneumonia, UTIs, and sepsis. The correct answer is D. Staphylococcus aureus infects burns too, but it is a gram-positive coccus and does not make blue-green pigment. Choice A wrong. Klebsiella is a lactose-fermenting oxidase. Negative rod without biocyanin or the grape odor. Choice B wrong. This is Pseudomonas aeruginosa. What is the mechanism of exotoxin A? Pseudomonas aeruginosa produces exotoxin A, a major virulence factor that kills host cells. Read the command, the mechanism of exotoxin A. It ADP or bacillates. EF2, the same as diphtheria. Pseudomonas EXO2 CN A ADP ribosylates elongation factor 2 EF2 shutting down host protein synthesis and killing the cell. This is the same mechanism as diphtheria toxin, a favorite NBME pairing, and it drives much of the tissue damage in Pseudomonas infection. The correct answer is C. Raising camp via Gs is the mechanism of cholera toxin and the heat-labeled toxin of ETEC, not exotoxin. A choice, A wrong. A superantigen is how TSST1 and streptococcal toxins act, activating many T cells rather than blocking EF2. Choice D wrong. Exotoxin A inactivates EF2. Which organism is most likely? A neutropenic patient on chemotherapy develops a round skin lesion that becomes a black necrotic ulcer with a red rim ectoma gangrenosum. Blood cultures grow an oxidase-positive gram-negative rod. Read the command, identify the organism. Ectoma gangrenosum in a neutropenic patient is Pseudomonas. ECTHMA gangrenosum, a rapidly necrotic black skin ulcer with a red halo, is a hallmark of Pseudomonas aeruginosa bacteremia in neutropenic patients. Pseudomonas invades blood vessel walls, producing the localized necrosis. The same organism causes hot T-tube folliculitis and malignant otitis externa in diabetics. The correct answer is B. Staphylococcus aureus causes abscesses and cellulitis, but the black necrotic ectyma gangrenosum in neutropenia is the Pseudomonas aeruginosa, and staph are gram-positive cocci. Choice A wrong. Aspergillus can cause necrotic lesions in the immunocompromised, but it is a mold with septate hyphae, not an oxidase. Positive gram, negative rod. Choice C wrong. This is Pseudomonas aeruginosa. Which organism is most likely? During an outbreak linked to contaminated water, adults develop massive, painless, watery diarrhea described as rice water, stools, leading to rapid dehydration. The comma-shaped organism's toxin permanently activates Gs, raising camp. Read the command, identify the organism. Rice water stools from a comma-shaped bug with the camp-raising toxin is Vibrio cholerae. Vibrio cholerae is a comma-shaped oxidase-positive gram-negative rod from contaminated water. Cholerae toxin permanently activates Gs, driving camp up and pumping chloride and water into the gut. The result is voluminous, painless rice. Waiter, diarrhea and dangerous dehydration, treated with aggressive oral rehydration. The correct answer is E. Enterotoxigenic E. coli raises camp too, but it causes a milder traveler's diarrhea, not the massive rice water stools of cholera. Choice A wrong. Rotavirus causes watery diarrhea in young children by damaging small bowel villi, not through a Gs, activating toxin in an adult water outbreak. Choice B wrong. This is Vibrio cholerae. Which organism is most likely? A man with hereditary hemochromatosis eats raw oysters and within a day develops fever, hypotension, and rapidly spreading skin lesions with hemorrhagic bullae on the legs, progressing toward fulminant sepsis. Read the command, identify the organism. Raw oysters plus iron overload or liver disease with bullae and sepsis is Vibrio vulnificus. Vibrio vulnificus lives in warm seawater and shellfish. In people with liver disease or iron overload, hemochromatosis, eating raw oysters or getting a seawater wound can cause fulminant sepsis and rapidly spreading cellulitis with hemorrhagic bullae. Excess iron feeds the organism, making these hosts especially vulnerable. The correct answer is A. Vibrio cholerae causes watery diarrhea, not the wound, sepsis, and hemorrhagic bullae seen here. Choice B wrong. Pastorella montosida causes rapid cellulitis after a cat or dog bite, not after raw oysters in a cirrhotic choice. D wrong. This is Vibrio vulnificus. Which organism is most likely? A young adult has several days of bloody diarrhea, fever, and cramps after eating undercooked chicken and handling a new puppy. The comma, or S-shaped organism, grows at 42 degrees C and is oxidase positive. 3 weeks later, he develops symmetric ascending weakness. Read the command, identify the organism. Bloody diarrhea from a 42 degrees C, oxidase positive comma-shaped bug that precedes ascending paralysis is Campylobacter. Campylobacter jejuni is a leading cause of bloody diarrhea from undercooked poultry, puppies, or unpasteurized milk. It is a comma or S-shaped gull-wing oxidase positive rod that grows at 42 degrees C. It is the most common trigger of Guillain-Barré syndrome, ascending paralysis, and can also precede reactive arthritis. The correct answer is D. Salmonella and Shigella cause diarrhea too, but the 42 degrees C growth, comma shape, and Guillain-Barré link specifically flag Campylobacter choice A wrong. Clostridioides difficile causes antibiotic-associated pseudomembranous colitis, not a poultry-linked comma-shaped rod preceding paralysis choice E wrong. This is Campylobacter jejuni. Which organism is most likely? A 45-year-old has chronic burning epigastric pain relieved by food. An endoscopy shows a duodenal ulcer. Biopsy reveals a curved urease-positive gram-negative rod in the gastric mucus. The infection also raises the risk of gastric adenocarcinoma and MALT lymphoma. Read the command. Identify the organism. A urease-positive curved rod causing ulcers and gastric cancer or MALT is H. pylori. Helicobacter pylori is a curved urease-positive gram-negative rod that colonizes the gastric mucus and causes most duodenal and gastric ulcers and chronic gastritis. Long-term infection raises the risk of gastric adenocarcinoma and MALT lymphoma. Diagnose with a urea breath test or stool antigen. Treat with triple therapy, EAP-PI plus 2 antibiotics. The correct answer is C. Campylobacter jejuni is a related curved rod, but it causes intestinal bloody diarrhea, not gastric ulcers and cancer choice, a wrong. Zollinger-Ellison syndrome causes multiple refractory ulcers from a gastrin-secreting tumor, not an infection with a urease. Positive rod, choice B wrong. This is Helicobacter pylori. How does this organism survive stomach acid? And what test exploits this? Helicobacter pylori survives in the harsh acid of the stomach and is detected clinically by a breath test. Read the command how H. pylori survives acid in the test. It makes urease. The urea breath test detects it. Helicobacter pylori survives gastric acid by producing urease, which splits urea into ammonia and buffers the acid around the bug. This same urease is the basis of the urea breath test. The patient swallows labeled urea, and the organism's urease releases labeled CO2 that is measured in the breath. The correct answer is B. H. Pylori does not form spores. Spore formers are the gram-positive bacillus and clostridium, not this gram-negative rod. Choice A wrong. An acid-fast wall is a feature of mycobacteria, not the way H. pylori resists stomach acid. Choice C wrong. H. pylori uses urease. Which organism is most likely? A goat farmer in the Mediterranean has weeks of cyclic fevers that rise and fall, plus night sweats, joint pain, and fatigue after drinking unpasteurized goat milk and eating fresh cheese. The organism is an intracellular gram-negative rod that survives in macrophages. Read the command, identify the organism. Undulant fever after unpasteurized dairy in a farmer is brucella. Brucella causes brucellosis, marked by undulant rising and falling fever, night sweats, arthralgias, and fatigue. It is acquired from unpasteurized dairy or contact with livestock, goats, cattle, pigs, so farmers, veterinarians, and abattoir workers are at risk. It is an intracellular gram-negative rod that hides in macrophages. The correct answer is E. Coxiella burnettii Q fever also comes from livestock, but it usually causes atypical pneumonia or hepatitis from inhaled spores, not the undulant fever from unpasteurized dairy described here. Choice A wrong. Mycobacterium bovis can be dairy-associated, but it is an acid-fast organism causing tuberculosis-like disease, not this undulant fever picture. Choice C wrong. This is Brucella burnettii. Which organism is most likely? A hunter develops an ulcer at the site of a tick bite along with tender regional lymphadenopathy and fever after skinning rabbits. Only a handful of organisms is needed to cause infection, and the lab requires special biosafety handling. Read the command, identify the organism. Rabbits plus tick, ulcer with adenopathy, and a tiny inoculum is Francisella tularensis. Francisella tularensis causes tularemia. The classic ulceroglandular form is an ulcer at the contact site plus tender regional lymphadenopathy. It spreads from rabbits and ticks dermacentor, needs only a very low inoculum, and is handled at high biosafety BSL-3 because it is so infectious. The correct answer is A. Yersinia pestis also causes fever with adenopathy buboes, but it comes from flea bites off prairie dogs and rodents, not rabbit skinning and ticks, and its buboes lack a paired inoculation ulcer. Choice B wrong. Bartonella henselae causes cat scratch adenopathy tied to kittens, not rabbits and ticks. Choice C wrong. This is Francisella tularensis. Which organism is most likely? A camper in the rural southwest United States develops sudden high fever and an extremely painful swollen lymph node bubo in the groin after flea bites near prairie dog burrows. Read the command, identify the organism. Painful buboes after flea bites from prairie dogs in the southwest is Yersinia pestis. Yersinia pestis causes bubonic plague. A flea bite from infected prairie dogs or rodents, classically in the rural southwest US, leads to sudden fever and a very painful swollen lymph node called a bubo. It can progress to septicemic or pneumonic plague and is a potential bioterror agent. The correct answer is C. Bartonella henselae causes tender adenopathy too, but from a cat scratch, not flea bites off prairie dogs. Choice are wrong. Francisella tularensis causes adenopathy with an inoculation ulcer from rabbits and ticks, not the flea-borne painful bubo of plague. Choice B wrong. This is Yersinia pestis. Which organism is most likely? A woman is bitten on the hand by her cat, and within hours the wound becomes intensely red, swollen, and painful with rapidly spreading cellulitis. Culture grows a gram-negative coccobacillus. Read the command, identify the organism. Rapid cellulitis within hours of a cat bite is Pasteurella multocida. Pasteurella multocida lives in the mouths of cats and dogs and causes a rapidly progressive cellulitis, intense pain, redness, and swelling within hours of a bite. It is a gram-negative coccobacillus. Animal bite wounds are treated with amoxicillin clavulanate, which covers it. The correct answer is D. Staphylococcus aureus causes wound infections but usually evolves over a day or more, and it is a gram-positive coccus, not the Coccobacillus described choice. Wrong. Bartonella henselae causes cat. Ciareta is a disease with regional adenopathy days to weeks later, not the within hours. Cellulitis of a bite choice. C. Wrong. This is Pastorella mutocida. Which organism is most likely? A 10-year-old develops a tender, swollen lymph node in the axilla 2 weeks after being scratched by a new kitten with a small papule at the scratch site. In patients with HIV, the same organism can cause bacillary angiomatosis. Read the command, identify the organism. Regional adenopathy weeks after a kitten scratch plus bacillary angiomatosis in HIV is Bartonella henselae. Bartonella henselae causes cat scratch disease, tender regional lymphadenopathy a week or two after a kitten scratch, with a papillae at the site. It is usually self-limited in healthy children. In HIV or immunocompromised patients, it instead causes bacillary angiomatosis, red vascular skin lesions. The correct answer is B. Pastorella mutocida follows a cat, BIT, with rapid cellulitis within hours, not the delayed adenopathy of a scratch choice. A wrong. Toxoplasma gondii can cause lymphadenopathy from cat feces oocysts, not a scratch, and it is a protozoan, not this gram. Negative rod choice. C. Wrong. This is Bartonella henselae. Which organism is most likely? 5 days after surgery for a perforated colon, a patient develops fever and an intra-abdominal abscess. Cultures grow an obligate anaerobe, a gram-negative rod that is part of the normal gut flora and resides below the diaphragm. Read the command, identify the organism. An anaerobic gram-negative gut rod causing an intra-abdominal abscess is Bacteroides fragilis. Biacetioides fragilis is an obligate ana-A or oopic gram-negative rod and the dominant anaerobe of the colon. After bowel perforation or surgery, it seeds intra-abdominal ABCCs below the diaphragm. Its LPS lacks typical endotoxin activity, and it is treated with metronidazole. The correct answer is A. Escherichia coli is a common co-pathogen in gut spillage, but it is a facultative anaerobe that ferments lactose, not the obligate anaerobe emphasized here. Choice B. Wrong. Clostridium perfringens is anaerobic too, but it is a gram-positive spore, forming rod causing gas gangrene, not a gram. Negative gut rod. Choice D. Wrong. This is Bacteroides fragilis. What is the most likely diagnosis? A woman has a thin, gray, malodorous vaginal discharge. The pH is 5.0. Adding potassium hydroxide releases a fishy odor, positive with test, and wet mouth shows vaginal epithelial cells coated with bacteria. There is little inflammation. Read the command, the diagnosis, clue cells, fishy whiff, pH above 4.5. Thin gray discharge is bacterial vaginosis. Bacterial vaginosis is an overgrowth of Gardnerella vaginalis and other anaerobes that replace normal lactobacilli. The classic tetrad is a thin gray discharge, vaginal pH above 4.5, a positive with fishy amine test with KOH, and clue CELLs on wet mouth. It causes little inflammation, so it is not truly an itis. The correct answer is E. Trichomonas vaginalis causes a frothy greenish discharge with motile flagellated organisms and a strawberry cervix, thus more itching, not clue cells. Choice or wrong. Candida causes a thick white cottage cheese discharge with itching and a normal pH, not the fishy high pH picture of BV. Choice B. Wrong. This is bacterial vaginosis. Which component is directly responsible for this septic shock? A patient with an E. coli bloodstream infection develops fever, hypotension, and disseminated intravascular coagulation. A component of the gram-negative outer membrane triggers macrophages to release TNF and IL-1. Read the command, the component causing gram-negative septic shock. Lipid A of LPS endotoxin. Endotoxin is the lipopolysaccharide LPS of the gram-negative outer membrane, and its toxic part is lipid A. Lipid A activates macrophages to release TNF and IL-1 and triggers complement and coagulation, producing fever, hypotension, and DIE. Unlike exotoxins, it is heat stable, is not secreted, and cannot be made into a toxoid. The correct answer is C. Peptidoglycan is a cell wall component thick in gram-positives and is not the LPS lipid A that drives gram-negative endotoxic shock. Choice are wrong. The polysaccharide capsule is anti-phagocytic but does not itself trigger the TNF-ADL1 cascade of septic shock. Choice B wrong. The culprit is lipid A of LPS. What does a pink colony on MacConkey agar indicate? A gram-negative rod is plated on MacConkey agar and forms distinctly pink colonies. Read the command. What a pink MacConkey colony means. It ferments lactose. MacConkey agar sorts gram-negative rods by L-acetose fermentation. A pink K colony means the organism ferments lactose, producing acid that turns the indicator pink. The classic fast fermenters are E. coli, Klebsiella, and Enterobacter. Colorless colonies are non-fermenters like Shigella, Salmonella, and Proteus. The correct answer is B. The oxidase test is separate from MacConkey and is not what the pink color reflects. Choice A wrong. A non-fermenter would grow as a colorless colony, the opposite of the pink result described. Choice C wrong. Pink on MacConkey means a lactose fermenter. Which organism is consistent with this result? A gram-negative rod isolated from a wound is found to be oxidase positive. Read the command. Which organism is oxidase positive? Pseudomonas, the Enterobacteriaceae, are oxidase negative. The oxidase test detects cytochrome C oxidase, PSE eudomonas. Ayer uniosa is oxidase positive, along with Neisseria, Vibrio, Campylobacter, and Helicobacter. The Enterobacteriaceae, E. coli, Klebsiella, Proteus, Serratia are all oxidase negative, so a positive result rules them out. The correct answer is D. Escherichia coli is a member of the Enterobacteriaceae and is oxidase negative, so it cannot be this isolate. Choice are wrong. Klebsiella pneumoniae is likewise an oxidase negative enteric, not consistent with a positive test. Choice B wrong. The oxidase positive rod is Pseudomonas aeruginosa. That's the block. 40 reps on the gram-negative bugs. 60 seconds to lock the patterns. 2 gram-negative diplococcus, meningitis ferments, Maltosa has a vaccine, gonorrhea does not. Recurrent Neisseria means a terminal complement deficiency. Legionella loves water sources and drops the sodium. Shigella is non-motile with a tiny infectious dose. Salmonella is motile and H2S positive. Do not give antibiotics for EHEC. Rice water stools mean cholera. Proteus splits urea into struvite stones. Pseudomonas exotoxin A, ADP ribosylates, EF2, the same as diphtheria. Ecthyma gangrenosum in a neutropenic patient means Pseudomonas. Undulant fever is brucella. A painful bubo from fleas is plague. A cat bite is pastorella. A cat scratch is bartonella. H. pylori uses urease and raises cancer risk. Oxidase positive rules out the Enterobacteriaceae. Pink on MacConkey means a lactose fermenter. Gram-negative shock is driven by lipid A. Train process, not memorization. StepLogic. Learn how to think, not memorize. Next up in the micro series, atypicals, spirochetes, and mycobacteria.